Joining me in our studios now is Dr. Ola Brown, who is a medical doctor, a helicopter pilot, as well as a healthcare entrepreneur, founder of Flying Doctors Nigeria. Thank you so much for your time.
Thank you.
Thank you for coming in.
Thank you.
Those figures that I just reeled out are just over the last 24 hours, and then, of course, bringing us to the total. One thing that COVID-19 seems to have done is that it has exposed what is essentially a fragile situation with our healthcare delivery system.
Absolutely.
Which is what we now are faced with. COVID-19, we are told, isn't going anywhere anytime soon. So what we can do is fix the healthcare system. Absolutely. If it requires fixing. Do you think, what do you think about that? I mean, this is the aggregation of what may be some level of consensus.
So 2 years ago, I actually published my third medical book, and it was called Fixing Healthcare in Nigeria. That was the title. And I proposed sort of 5 major things that could be done. I released it for free, so free of charge, so people could learn about the healthcare system, look at some of the statistics in the healthcare system, see how bad it is, and look to improve it. And some of the things that I suggested were around our maternal mortality statistics, the number of mothers that die in the process of childbirth, some of the highest figures in the world. The number of children that die under the age of 5 years old are also some of the highest in the world, even compared to Iraq, Iran, Syria, Afghanistan. Our figures are comparable to those kind of countries that have been at war for a long time. I suggested centralization of some of our services as well to make sure that we achieve economies of scale, and I think that that's important. People think that you can have a world-class healthcare center in every state, but what I said in my book was there's a reason why Dangote has not put a factory in every single state. It's because you need a certain number of cases for specialists to see, and I spoke about technology as well, and the role of innovation in healthcare.
These are things that we're going to need now, because people are talking about the fact that while we're all focused on COVID-19, other things are falling by the wayside. Lassa fever, diphtheria, whooping cough, measles, tuberculosis. These are all things that are killing more people than COVID-19 has killed.
Absolutely.
So going forward, how do we do this now? You've mentioned the 5 areas, but how do we specifically target those? Because now attention is focused on it.
Absolutely. So in your intro, you said that I run an air ambulance, but I actually stepped away from that. I now run a healthcare investment company, so I've handed over the air ambulance to the management, and we raise money and invest in different areas of the healthcare value chain. So I think the investment is key, but not just anyhow investment, actually smart investment from experts that kind of know what they're doing, understand the data, and understand the healthcare landscape in Nigeria, and understand, most importantly, that we have to do a lot more investment and make a lot more impact with 10%, maybe 1% of the resources. So I'll tell you why that is so. In the UK, the healthcare budget per year is about $200 billion.
$200 billion.
For 65 million people. Our total budget in Nigeria, everything, it's about $25 billion. That's the entire budget. And remember that we spend about 60 to 70% on that, on debt repayments. So what we have left for healthcare is really small, and we have 4 times the number of people. And we don't even have the existing infrastructure to leverage on. So we need to be looking at healthcare in a radically different way from the way that it's done in the Western world. Because when you even look at the amount, in America, what they spend on healthcare per person, per citizen, is $10,000. So if you move to America today, your healthcare spend per capita would be $10,000. If you lived in Norway, your healthcare spend would be $7,000. If you lived in the UK, it would be about $4,300. If you look at the federal budget today, which is not always fully funded because of our fiscal constraints, you're looking at about maybe $10, $20. So from 10,000 to 20. So we need to be very, very innovative. We need to get people in the room that know what they are doing. We need to get policymakers in the room that have looked into the statistics and can make smart investments. We need to be looking at how we can really do more with less.
We've got a minute, and I must ask this in that minute. A lot of those who need all these services and who will be impacted by this are not in the city center, they're in the rural communities, which brings forward the question of affordability of all this.
Absolutely.
When people mention telemedicine, the question that follows naturally is, how do you get the tele or whatever it is down to the rural areas?
Absolutely.
Do you think there is a investment opportunities for those who are looking to invest in that kind of thing?
So we've recently invested in telemedicine quite extensively, and I think that this might be the only way for us to be able to, or one of the strategies that we can use to do more with less. So I'll just give you the last set of statistics. In Europe, you look at about maybe 42 doctors for every 10,000 people. In smaller countries, in less rich countries, you look at about 20. In Nigeria, there's about 4. So we have very, very few doctors. We have a huge problem with the brain drain. So how do we get those doctors to be able to access the patients that need them? And I think that that's one application of telemedicine. And we also have, Nigeria is a huge geographical space, lots of riverine areas that are inaccessible by road, lots of seasonal roads, lots of places that are very difficult to access, mountainous areas, etc. So we do need to find a way of bridging that gap. So telemedicine and telementoring, that's using doctors in central areas to guide the healthcare workers in rural areas, is a good way to try and bridge that gap in a cost-effective way.
The hand thing that you did for testing seems to have made some sort of mark, because it doesn't involve direct contact with.
Absolutely.
Is that the kind of thing that we need going forward?
I think we need a lot more innovation going forward. And I think that in healthcare conversations, in policy conversations, I think doctors have been a bit shy of really coming forward and saying what they know and sharing their experiences. So when we even talk this COVID, for instance, when we've been talking about COVID, honestly, I've seen a lot of other professions giving their views, writing long articles in the newspaper, but you know, the percentage of doctors have actually been quite few.
Very small, yes.
And we actually know the most about the problem, but we haven't been very vocal about it. And I've always said that medicine, healthcare, is the only place that you'll find that the professionals in the industry are not the captains of the industry. When they're calling bankers, you see all the actual bankers there, but when they're doing healthcare, anybody can come in. You'll see, you know, anybody from any industry except the people that actually work in that industry. And I think that's something that has to change, so we can have a group of experts that really understand the system, people that have experience in healthcare, right. Doctors, nurses, physiotherapists, pharmacists, to really come together and start thinking about policy that actually works, policy that makes healthcare acceptable, affordable, and accessible to the majority of Nigerians.
Dr. Ola Brown, a lot of things to chew over for administrators. Thank you so much for your time.
Thank you.
Thank you so much for coming in.